It's a real pleasure to be here this evening and to be part of an evening that included Doctors J. Kumar and Morris. And I think it's a very exciting time for me because it symbolizes something that's crucial in medical care, and it's the idea of complete breast cancer care. And I just want to explain that. It's the integration of the best that the conventional medical system provides, and then everything else that you can do to help yourself along your journey and help others along the journey. So it's very exciting. I want my hats off really to the BCANS, Breast Cancer Action Nova Scotia, for organizing this event, and to the medical system for helping to facilitate this, and to Pfizer, who helped sponsor the event as well. And to all of you, you're crucial. Whether you have had a diagnosis of breast cancer or you're a loved one along, we're part of this together, and that's part of what my message is going to be tonight. So I want to honor you, first of all, and just state very clearly, you can make a difference in your health. It's very clear, and I want to give you some ideas to empower you about how to do that. And so this lecture is about empowerment. So by empowering yourself with medical information, by getting the best from the conventional medical system, by augmenting that with simple, effective health habits, and by adopting a proactive and positive attitude, you can definitely improve your quality of life. And the science is now showing it actually changes survival rates, longevity, and probably, well, for some, I believe, even the chance of being cured of cancer. I say that, but in the same breath, I want to say that what's most important as well is how you feel, how you can cope with your journey, how you're able to enjoy your life more, and be able to appreciate the joys and the splendors of this wonderful life that we've been given in the company of your wonderful, loved ones. So it's about getting the best care. It's about being physically well, but it's also about wholeness and health. And I just want to integrate the two together, the best from the physical world, the best from the psychological, spiritual aspects of care. I want to honor you because you came here tonight, and you're listening to this talk and the talks before here. And I think that sends a very powerful message about healing and about wholeness. What are you saying to yourself? You're saying, I want to learn, I want to get better, I want to understand. And I honestly think that percolates down into doing just that, because I believe there's a strong connection between the mind and the body, and even the spirit, however you want to define that. That healing at one level promotes healing at the other levels. And the obvious example around that one is stress, your perception of what's happening. And you literally, by what you're thinking about, change the chemistry of your bloodstream, change the physiology of your body. So you can be in a high stress state where the hormones are literally coursing through your body and causing degeneration or breakdown of the tissue. In a sense, kind of shutting down the heart vessels, the blood vessels, as an analogy. Or you can perceive life differently and allow yourself to let go and relax in a certain sense, promote that relaxation response that will literally change the chemistry in your body. So it allows the natural healing energy that's there to help you recover from your surgery, to boost your immune function, to fight off any cancer cells that might be there, to improve your health, and ultimately how you appreciate life. In a sense, it opens those heart vessels, opens your psychological heart. So that's the mind affecting the body, but there's also the idea of your spiritual life. And by spiritual life, I'm talking about where you find meaning, where you find purpose, where you connect with your life, where you connect with your loved ones, or where you connect with something higher. So as you nurture that spiritual life, what's most important to you, then it has an influence on the psyche and the mind. You're better able to let go of those unhealthy worries, the worries that aren't helping you, or better able to break out of patterns of behavior that haven't been helpful in the past. So in a sense, you let go, that causes a relaxation response, which ultimately percolates down, funnels down into the body. So your physical body can be there. Spirit, mind, body. You can empower yourself in those realms there. And I know it's possible because I see it. I see it in the people that have gone to the support groups. And I just know we have that capacity. And even though I'm going to talk about some great people, ordinary, extraordinary people, I just want to say that we all can do it in a different way. So I'll share stories with you about the amazing people that I've connected with over the years. One of those people was a young woman with breast cancer who had a young son. And I started out this initial consultation with her. And she was quite clear that she wasn't scared of dying. That was not the issue for her. The issue was she wanted to be well for her son. And as we talked, I was just remarked at how peaceful she was. And at one point in the conversation, she talked about her spiritual life. She said, and this is a woman who's very likely to be cured of her cancer. It's a very early disease, very high chance of cure. She said to me, I don't pray to God to be cured of my cancer. I pray to God to give me the strength to face whatever arises. I pray to God to give me the strength to face whatever arises. When I hear that, my wisdom bell starts ringing. This woman is onto something, right? She's in the next realm there. The idea is she's letting go of the things she can't control and focusing her energy on the things that she can control. And she's sitting there relaxed in front of me. I can just see that this is helping her physically as well. So I want to offer you those type of stories, those type of ideas, because we all have that capacity to tap into that next realm if we so choose. And I want to offer you some very practical advice, body, mind, and spirit, and the scientific data that shows it makes a difference in breast cancer. So it's very exciting times because the scientists are finally catching up to the obvious. That Grandma had it right all along. We just have to listen to her. So I want to offer you that wisdom, in a sense, that I've garnered through the years in the support groups and the wonderful people that I've tried to serve over the years. Before I do that, though, I want to spend just a few minutes doing a very simple visualization exercise. So we're going to do this together. You can join me if you want to. It's an invitation to join me for 2 or 3 minutes, very safe, very comforting visualization. So what I'd like you to do is to find a nice firm way to sit up with your feet flat on the ground. And just a nice straight spine, almost like this feeling of nobility, like there's a strong structure at my back. And yet at the same time, my chest is open and heartful. You can have your hands on your laps or your knees and just feel, you can have your eyes down, your eyes closed. Just feel how it feels to be in your body right now. So simply bring your attention to your body and the sensation of being here. You can feel your feet flat on the ground, and the hands in your lap, and the weight of the body in the chair, how it contacts your chair. Allow yourself to be just as you are right now. You can watch your breathing in and out. Now bring your attention to the area of your heart. And as you go through this visualization, I want you to pretend that you're generating this feeling of compassion, of caring. You may think of a little baby or a really close loved one, this feeling of just total loving, caring kindness. And as you begin to generate that feeling of loving compassion, think how you could direct that same loving energy towards yourself, some aspect of yourself that needs healing. Might be a physical ailment that needs healing, or some part of your body otherwise. You may send that loving kindness towards some psychological problem or issue. There may be a relationship that needs healing in your life. Just send that feeling of compassion and caring to yourself. Now choose a loved one in your mind and begin to send that loving energy towards that person. Just true caring, whatever aspect of their life needs healing, whatever is best for them. Just allow your heart to expand out to that person. Wish them well in whatever way is best. Now send that same energy, that same feeling to everybody here in the room. Maybe wish them whatever is best for them. Maybe some insight they may gain from the lecture. That they be happy, that they be at peace with their life. Great, wonderful, wonderful. You can bring that same feeling, that same energy back into the lecture. You can draw that with you into that lecture and through your life. So you bring your attention back to me standing up top here. That was really lovely. I love the feeling of that group energy. I put you through that very simple 2-3 minute exercise to make it clear that we all have that option to slow down in our lives and to tap into that compassionate and loving part of ourselves. And I believe that at that same place of true heartfulness is great wisdom. That we have this inner wisdom that we simply need to slow down to begin to respect and allow that wisdom to help guide our journey. So it's there for us, and it's such a wonderful energy. You've done me a great favor. Thank you. I'm going to tell you a few stories about myself. I'll tell you the story first. A few years ago, when I was first putting together support groups, I sat in a support group, and 2 people over was a young man who had had an advanced cancer and had gone through bone marrow transplantation. He was doing great. And he said to the group, he said, "I'm really looking forward to my 30th birthday." And that was a year and a half away. You know, I will have achieved my goal in a sense. And just the way he opened up and the way he shared kind of released within me this feeling of overwhelming compassion. My heart kind of leapt out to this character here. And in that moment, there was a blurring between himself and myself. The boundary was suddenly broken, and I could see that I was no different than him, that I could easily be sitting in his chair and he easily in my chair. And it really kind of opened my heart at that moment. I tell you that story because I believe that we're in this together, that there isn't a separation, really, at some very deep level between those who have been given the cancer diagnosis and the rest of us. I don't see the world that way. I tell you that not to say that I know how you feel, because I don't know how you feel, but I say that because we're talking about empowerment. And it's not a one-way street. It doesn't go just from me to you or your loved ones to you who have a cancer diagnosis. In fact, we're on the journey together. We're on the boat of life together. And so I often learn so much from the people I'm trying to serve on the day-to-day. The other one is the person who has the diagnosis is often the wise one, or does some wise things that can really wake us up sometimes. And so that wise person sometimes can offer great gifts to their loved ones, their family members. Sometimes the gift is to have a good cry. Sometimes that gift is to show a great sense of peace and honor through difficult times. Sometimes that gift is to say to their loved one, "Geez, I'm having a really tough day. Could you please help me in this way?" That's a tremendous gift. So I want to kind of murky the waters a bit to say that it isn't just about the person with the cancer. It's about all of us in our journey along life there. I'll tell you a little bit about my journey as an oncologist in the same way, because I continue to learn, I continue to garner from the wonderful people who I've served. When I was a medical student, I didn't know what kind of physician I wanted to be. And I had one of those life-altering experiences in which I walked into the library And it was one of those scenarios where the book kind of falls off the shelf, kind of lands in your lap type scenario. It wasn't quite like that, but you know the feeling, your hand's going out to the book and something's inside of you saying, this is it, 10,000 volts of energy are coming here. And the book that I read and started to read was called Love, Medicine, and Miracles by Bernie Siegel. And I guess a few people recognize that title. Bernie was a cancer surgeon who was a pioneer in support groups. And he began to really listen to people and said, how can you live your life best between the office visits? And he wanted to know how some people did so well and other people, were feeling very stressed. And so he began to notice that there were certain patterns. He called them exceptional cancer patients. I don't like to cut up life like that because I think people are exceptional in all sorts of different ways, but he called them exceptional cancer patients. And his patients, he noticed, lived much longer than expected. Their tumors melted away faster. They recovered better from their side effects from their treatments. They just did amazingly well. So that's what he kind of categorized them. And he also noticed that they had certain attitudes or certain personality traits that allowed them to do much better. And one of the traits that he talks about in his book is the idea of acceptance. And I'm not talking about, kind of resignation, I can't do anything. I'm talking about the idea of saying, this is the reality of the situation, and I'm going to move from here. So no matter where you're at psychologically right now, it's okay to be upset. That's the starting point for you. So we accept that that's how I feel, and then we move forward. And it's probably best captured, again, in a story that's happened to me very, very recently. I was close with another medical school classmate, just a wonderful, wonderful woman, and we kind of parted paths after medical school, shared the occasional Christmas card and kind of update of how our families were doing. And then about 2 months ago, I got an email from her, and she said, Rob, can we talk on the phone? And whew, red flag goes up, right? Some things matter. I was worried about somebody in her family who had cancer. And I got her on the phone, and it was her. She had the breast cancer diagnosis. Had found a lump in her breast, had found a lump in her axilla, and was about to have a mastectomy. And thank goodness the staging tests were clear, so there's no other obvious cancer in her body. I mean, I had tears in my eyes just kind of thinking about it and starting out in that conversation. But as soon as I was on the phone, I was awed at her presence of mind. I could not believe how together she was. And she said, I'm going to read you some of her letter here, but she basically said, there's a sense of peace here. And my friends say to me, you're going to beat this. You're going to beat this cancer. And she said, I've looked at my own mortality now, and I don't know if that statement is true. So I thank my friends for their goodwill and just say, thanks very much, but we don't know what the future brings. And yet, at the same time, she's being very positive. So I just want to read a little bit of her email to me, because she is remarkable. We're all remarkable. She said, and this is around the issue of acceptance, right? I'm telling this about this idea of accepting what's happening. She writes, but once I managed to accept that the reality of my mortality had always been there, I could accept that nothing fundamental in my life had really changed with this diagnosis. I'm still the same me. My life has not changed dramatically or drastically. I'm still here. I was not hit by a bus. My loved ones are still around me. Unbelievably, I can honestly say that I'm as happy now as I was 5 weeks ago. I am, even in this moment, missing a body part or two, hair about to fall out, completely and utterly whole. She goes on to say, it allows me to see in the last few weeks and the year ahead as the first steps towards, rather than the plunge from, true wellness. I'm not saying that we all have to be like her. I'm just saying there is that capacity to see life from a bigger picture. This is where the paradox comes in, though. Listen to, that's very much an acceptance, right? Listen to this next paragraph here. After a day or two of despair, my attitude has been exclusively positive. So she did. She was really scared for the first 2 days. It's normal to be scared for 2 weeks minimum. That's the freak out zone. That's normal. So she was really scared for about 2 weeks, 2 days. My attitude has been exclusively positive. From that point on, I have known that I will be okay. Maybe not okay in the way that I would have defined 5 weeks ago, but in a bigger sense. I felt that while I cannot be positive that I will beat this, I can be positive that I'll have the courage to face what is ahead. I am positive that I will have the support from loved ones, the expertise from my doctors, and ultimately the grace from God to ensure that this turn in the road will not be a negative force in my life. And I believed all that, and I still believe that from deep within my soul. But in the last 2 weeks, something else has crept in. I'm starting to believe, or want to believe, that I will beat this in the conventional sense. I'm starting to demand it of myself and to ask it of God. There is a proportion of women who survive breast cancer of my stage, so why not me? Right? So acceptance is not resignation. Acceptance is, yes, this has happened, and I'm going to do what I have to do to get better. And that's really hats off to just an extraordinary person. So acceptance was the first idea. Another one that's a true paradox is this idea, and this is out of Bernie Siegel's book. He basically said that the exceptional cancer patients no longer viewed recurrence of the cancer or death as a failure. It was no longer their top priority. And here is the paradox. Yes, we want to be better, we want to be well, we want to respond and get better and physically well and so on. But the exceptional cancer patients would put their energies into the things they could control, like their attitude, their degree of compassion, their relationships, what they did with their lives, how they connected with people. And when you get into that realm, that's when the miracle can happen. Miracles can happen there, where there can be an influence at the physical level as well there. And we see it in the spontaneous remission patients and so on. I'll talk about that later. But that was the second concept, that death was no longer a failure to the exceptional patients. And the third theme that I'll talk about, and there's lots of other themes in the book, the third theme I'll talk about was this idea of self-care and self-love. And I can't state this enough, that as a foundation for your own health, you have to take care of yourself first. It's like when the oxygen mask comes down in the plane, you put on your own oxygen mask first and then you help out a loved one. It's not, you don't have to feel guilty about taking care of yourself, because when you take care of yourself, you're able to serve others better. And I want to share a story with someone's permission about a support group from 2 years ago, about a woman who said that every morning she wakes up and goes through a visualization. And the visualization is this. She imagines that there's a cup within her chest. And she pours in the light of loving kindness. And she fills up that cup of loving kindness and fills up her body and helps with the physical healing. And she pours and she visualizes loving kindness filling up the cup and filling up her mental and psychological issues. And she pours in her cup even more, and it helps out her spirit. And only then does the cup overflow. And it helps other people. So she fills up her cup first, and then she sends that love out into her life. Right? So we need to take care of ourselves. It's okay to take care of yourselves. It's that balancing act. So I read this book, and I was crying because I knew that this is what I wanted to do in my life. There was just no doubt. I wanted to be an oncologist. I wanted to run support groups. And so I actually went to a Bernie Siegel weekend. And this is as an intern. I was just out of medical school, as green can be. I was sitting in the front row. There was just a few more people in the room than what we have here tonight. And I was wondering to myself, what is Bernie Siegel going to offer this group of almost all cancer patients and their family members? And Bernie came up to the microphone very calmly, very coolly, and he said, I'd like to start out with each of you telling us a bit of your story. You, sir, at the back, can you start us out? And believe it or not, 180 plus people stood up and told us a little bit of their cancer story. And it was a remarkable, remarkable experience. And if you've ever been in a support group in which you have that bond, you'll understand you can't describe that energy. It's just a magical energy. But people truly listened. And people cried, and there was just some few good jokes throughout the whole business. I learned more in 2 hours listening to those stories than I had in all of medical school about cancer and its effect in life. And so I came back as young resident doctor, hoping to understand, hoping to get a perception of what goes on, how do people cope with it, how can I help them in the best way possible. And the first thing that I noticed was that people come to the cancer diagnosis with their own issues, right? We're all kind of, in a sense, the walking wounded, and we don't talk about it very much, right? So whether from our childhoods, somehow we're not good enough or we're too good, and we kind of repress down these emotions, these feelings, and we kind of put on a happy face for the most part. And then when the cancer diagnosis comes, there's the 2 weeks of freak out, right? So the emotions are released. And so I just want to say that it's normal. It's normal to be upset. It's normal to be feeling lousy psychologically at any time during the process. That is the accepted normal. And because we don't talk about it, that's why people feel totally alone. That's another common issue, right? And that's the other reason why I'm glad people are here tonight, because you start sharing stories, start connecting with people, start understanding that you're going through the regular process. And it is encapsulated by a friend of mine who is this wonderful man. He happens to be a professor from university. He's a chaplain in the hospital. He's a minister. He's just a real wonderful, wonderful person, and very well supported from his family and so on. And he said when he got the cancer diagnosis, what he did is he went and booked himself a game of golf by himself. And he said he cried for the full 3 hours that he was out there. So just kind of let out his emotions and felt totally alone. It was the journey into the forest, or that dark night of the soul feeling there. So people feel alone. If I'm going to offer you advice around that, find somebody in your life who can listen to you. Listening in and of itself is therapeutic. It really is therapeutic. So do what you need to do to find that. If you're not a support group type person, then find the wise one within your life. I'm going to get on to some advice now. There's all sorts of different advice that people offer out there, and you can get adviced out, or you can be like the cancer hero that does everything. Gets up and meditates for like 3 hours, and then runs 10 miles and drinks fruit juices all day long, and just goes to the internet and looks for the next latest thing. You can spend a lot of energy freaking out, right? Doing all that stuff. You might just miss out on your loved ones during the process. So not to say anything there is bad, it's just that you might want to keep it in balance. So I'll offer this big smorgasbord of advice, realizing that you might want to just start out with a small meal of what's here. So you might listen to your gut, see what resonates, see what makes sense to you there. And things will keep on changing with time. So we're going to start out with some basic advice. And I break it down into body, mind, and spirit, realizing that we're all of those all the time. So these are just different aspects of ourselves. It's artificial to break these things up. But if you're going to remember anything about tonight's talk, this is the number one piece of advice. Number one piece of advice: exercise. Exercise, exercise, exercise. The studies are so clear about this fact. Even people who have just starting on their cancer journey, about to start chemotherapy, the scientific studies show that they have got more energy, better quality of life, they sleep better, and they recover better. So they keep themselves stronger. Exercise changes the hormones in your brain. It releases the happy hormones. If you're depressed, other than taking a medication and changing the chemistry that way, exercise is the easiest way to change the chemistry in your brain and make you feel better. And there's a whole bunch of other studies that show it really influences quality of life in women with breast cancer. No matter where you're at in your journey, Try to get out there 3 times a week, 30 minutes, get the heart rate up. Do it with a friend. Now, see, the point is that oftentimes we get very frustrated and anxious and nervous and upset, and that is life energy in and of itself. What I'm asking is you take some of that frustration and focus it into exercise. Burn off the stress hormones. Get yourself going, make yourself feel better. Walk with a friend, do something that helps. And the data shows, here is the knockout data. So they did a huge, they watched tens of thousands of nurses for decades. They saw that 3,000 nurses had developed breast cancer, and they interviewed these nurses on average 2 or 3 years after their diagnosis and said, how much exercise are you doing? And then they watched them for 8 years. Do you know the nurses who were walking the equivalent of 3 hours per week or more had a 50% less chance of their cancer coming back than those who had been walking less than an hour per week? So you think about it, you're actually changing the hormones in your body by getting out there and exercising. So that's number 1. If you're going to remember anything, exercise. Number 2, in terms of the body, is nutrition, right? You can definitely empower yourself with nutrition. By decreasing the fats in your system, by eating the fruits and vegetables. Honestly, the Canadian Cancer Society has it right, 5 to 10 per day. Mix up the vegetables, colored vegetables, fruits. What they have is antioxidants. It's the substances, the natural substances that prevent further breakdown of the cells. So there's nutrition there. Go see a professional nutritionist. It can really help get you set in the ways there. The data, here's the other fantastic trial. The data showed that they had 2,400 women who had breast cancer and looked like they were going to be cured of their breast cancer. They taught half the women to decrease the fat in their diet, and half the women, they said, do the usual things. Use your usual diet type thing. The women who were taught to decrease the fat in their diet actually were able to do it, so you can actually change your diet. And not only that, the groups were exactly the same, but the women who had changed the fat in their diet had 2.5% less chance of their cancer coming back at 5 years by simply changing the diet. Very simple thing. If I had a drug that gave you a 2.5% improvement, I'd be offering it to you, especially if there were very few side effects. There's no doubt about that. So, exercise, nutrition. Number 3 is maintain a reasonable weight. And that you need help with, and especially if you work on exercise and nutrition, and get some professional help and join curves or whatever you need to do. Those 3 risk factors contribute to about 30% of the risk of breast cancer in our population. So if we had a really good exercise program, good nutrition, maintain a reasonable weight, there'd be 30% less cancer. Now, I'm not trying to blame anybody. What I'm saying is that once you have cancer, you can do the same things, because if it prevents cancer, I would argue it prevents the cells from becoming more aggressive if the cells are in your body. So you want to prevent further mutations or further changes. The 4th pillar, and Grandma had it right, the 4th pillar is sleep. Get a good night's sleep. And what the data is showing there is that there's this hormone that's released if you have a good night's sleep in darkness, and it has to be darkness. Because when you're in the dark, this substance called melatonin is secreted into the body, and the melatonin has an influence on the cellular pathways, the ways that cells proliferate. And so the risk factors are proven. So for instance, air stewardesses that travel north-south have less chance of developing breast cancer than those who travel east-west. Night shift workers, those who are up 3 nights per week, have twice the risk of developing breast cancer than those who don't have to work on the night shift. Yes, there are other factors between those 2 populations, but it makes sense. Even the animal studies where they take samples from women who are either having a good night's sleep or in darkness or not, and they secrete the blood into tumor cells in the rat bellies, And the blood that's there that has melatonin in the women that have a good night's sleep actually able to repress the cancer cells, whereas if you don't have a good night's sleep and don't have the melatonin, you're not able to repress the cells. So those are the big 4 factors. And the 5th factor we're going to do right now together. So if you would be so kind, let's stand up together. I'm going to take you through a very simple exercise called Qigong. We're going to do it for about 2 minutes. Do what you can do, don't do what you can't do. Okay? You don't have to do this if you don't want to. You can sit down or whatever else. Simply start by raising your hands straight forward. And good, that's not touching anybody. Bring your hands in towards your heart and then push your hands down. That's good. Same thing again. Raise your arms up like a zombie. Bring your hands towards your heart and push down. On the down, just bend your knees a little bit. And up towards your heart and push. And as you bend your knees, push your energy down into the ground. That's good. And up towards your heart and push down. And breathe in on the way up. Breathe in towards your heart and press down. Ooh, press out. That's it. And up and in and down. And up and in and down. And just a little stretch this way. Ah. And a little stretch that way. Ah. That's good. And you can sit down again. Now, that's great. Now I could have done a relaxation exercise, but I think we all needed just a little stretch-orama at 8:45 at night. The 5th pillar is actually relaxation. And I've taken you through a Qigong exercise in which you're concentrating on your body. If you're going to do relaxation, then you need to do it so that your mind actually slows down a little bit. So oftentimes I could have taken you through a visualization in which you visualized a really happy point in your life and just had a really good relaxation response. I take you through that because you can actually change your physiology. You can actually change the hormones in your brain. You can change the stress in your system. So either you're very good at stress and the brain is getting very good at programming stress, or you can teach yourself a relaxation technique. And as you do that, the brain actually changes, actually sets down new pathways, and you become more relaxed with time, and then that relaxation follows you into your life. And it really has a profound influence. And that's the 5th pillar. It's the pillar that we in the West don't practice very well, or at least group ways. So whether it's meditation, or a body scan relaxation technique, or some type of yoga, Qigong, for those who are kind of more active, you need to practice relaxation. It really can help you profoundly. So there's the 5 pillars. You know, I offer that advice, but you know, if we just listen to our body, we would know how to eat, or we know that a good night's sleep makes you feel better, or exercise gives you the happy hormones. You can do those things, and there's a feedback system in your body. When you're feeling stressed, it's because something isn't quite right, and you use that wisdom. When you're feeling, I feel like I'm in my body, I'm relaxed, you can also use that information and say, geez, that feels good now. So there's a feedback system there. So listen to this body. And lastly, we want to love our bodies. Our body is just a wonderful tool. It gets us out into life. So we honor this wonderful gift that we've been given. It allows us to extend a hand to help people. It allows us to give a hug and to receive a hug. So we want to just take care of it in a way that works for you. So there's the level of body. There's the level of mind. And we're all very unique. So again, I'm offering all sorts of different advice. The first thing is this false expectation, like things have to be right, or I have to be happy. And only if I was happy, only if I was at peace would things be better. The fact is that we're all going to continue to come in and out of the stressful points in our life. That's the norm. And if you set yourself up thinking, oh, well, if I could just get over there, if I could just be stress-free, it'd be fine. We are living our lives right now. And we kind of take away an extra layer of frustration and irritation if we just say, this is how I am, this is what I'm feeling right now. So you can kind of step up and take away that extra layer of suffering to say it should be different. We're kind of struggling with reality. We're always going to have decisions. We're always going to have tensions in life. There are always balances to be had. So we want to walk the middle road. That's my philosophy, at least. And so there's the tension between taking care of yourself, that I strongly endorse, and extending your hand out to others and helping others. There's the tension of living in this moment, this wonderful, precious moment of life, and planning for the future. There's that tension between having, to do your research and being smart about the medical system and letting go and trusting your physicians that they're doing the right thing for you. So we want to do both those. There's a tension between getting somewhere, trying to do something, trying to be proactive, and letting. So you're gonna run this balance in your life. Let go and not let go. Between doing and being. It's always the same tensions there. If I'm going to offer you some advice from the level of the mind, it's this. It's a 2-letter word. The 2-letter word is no. Just say no. Nike, just say no. The issue is that we're so busy often. And I think that we need to learn to take care of ourselves. And one of the ways to take care of yourself is to eliminate the things that aren't important, the non-essential activities. Right? So if you're asked to do something that you don't really like and it's not really necessary, then you need to learn to say no, right? And there are 3 phases to saying no. It's opening your mouth, saying no, and closing your mouth. And guess where we screw up most of the time? Phase 3, right? No, but I'll do it. No, just say no. I mean, I need to take care of myself. This is important to me. I honor myself. I love myself. I'm going to eliminate that. That will create the space for the things that you love. And doing the things that you love are critical. There's happy hormone heaven right there. Do what you need to do to give yourself that joy in life. It's okay to be happy. It's okay to be joyful. What activities did you do in the past that you really enjoyed? What craft or hobbies or where do you find your bliss in life? Go there. And that can help you more than anything. I honestly believe that. And lastly, this idea of self-acceptance, that we love ourselves. We accept ourselves. We're totally human. And I like the image of this Japanese art form where they take a beautiful vase and they drop it on the floor. And it breaks in multiple pieces. And then they start to put the pieces back together, and they put it together with these beautiful gold fillings, in a sense. And I honestly think that represents the human spirit, the human condition. That through our brokenness, where our brokenness is where our wholeness is, where our beauty is. Right? Where we're broken, where we're suffering, it also this opportunity to let the light shine out through the vase itself. So I just give that to you, that we love ourselves despite our weaknesses. We still aspire to be better, but we love ourselves here and now. So that's the mind level. At the spiritual level, I don't want to preach. I'm not preaching in any way or form. I just want to offer you my insights around this. And if you've had a spiritual practice or a spiritual community that's been very nurturing for you, go there. Do that. Whatever has worked for you in the past is fine. But I really don't separate the spiritual level from the other 2 levels. Because when you really honor your body, when you really love yourself, you're kind of loving life in a sense as well. And as you slow down, as you practice the mind-body techniques, then you begin to understand, you begin to perceive that there's something underlying, something that's like a matrix or a skeleton that's holding life together. And we start to resonate with this underlying feeling. I liken it to this feeling at peace despite the stresses and psychological difficulties that we suffer. So if you're out in the middle of a hurricane and you're walking down the beach, the waves are crashing down, there's a wind coming this way and the whole business. That's the kind of the mental, psychological level of the hurricane. At the spiritual level, it'd be like being 30 or 40 feet down into the water. And it's a whole different perception. It's actually quite calm down there, despite the psychological turmoil. And what's wild is that you can experience both of those at the same time. And I've seen it in support groups. I've seen the guy who's saying, you know, he's got guy's almost in tears. He's saying, I just feel so terrible. I'm really worried about my wife. I'm really worried about my daughter. And he's kind of clutching his chest and he's saying, I've got this pain in my heart. And then in the same sentence, he'll say, he said, this is a real story. He said, you know, but I feel very peaceful. Like there's a sense of harmony here as well. So there can be that two levels at the same time. And I've seen a woman in a support group also say, you know, she was mourning the losses in her life. And yet she was saying, there's something that is also holding me there. So she's sad and felt held, like she's walking across the desert and something's going to extend its hand out to her. It's like step at a time. As you step, the stone appears for your foot. It's that feeling of being held there. So that's what we can do. We can slow down and experience the spiritual life. I'm going to tell you about my meditation practice because I think it offers some insight into kind of spiritual life. Most mornings, probably 5 mornings a week, I get up half an hour earlier and I go and meditate. And it's a very simple technique. I simply sit on the floor and relax and watch my breathing. Simply concentrate on my breathing. And within about 2 seconds of me starting to meditate, my mind starts chattering. And I'm like, I've got to do this today, and I got this to do, and I'm going to do that one there, and I've got to talk to that person. At some point in time, I realize that I'm off in some fantasy world. And I bring my mind back and start focusing on my breathing again. And within about 2.5 seconds, the chattering mind comes up again. And I'm thinking, oh, did I say that yesterday? Oh, that was not a nice thing. And I'm like off into some fantasy about what happened yesterday and reliving, you know, 3 meetings later. And at some point in time, I realize, I should be meditating. Here. Breathing again. It goes back and forth, really 1,000 times. Well, not 1,000 times, dozens of times within a single half an hour. I'm out and then, but something remarkable happens. At about the 40-minute point, something clicks, and I'm like, oh, just like relaxing into my body, and I feel much more peaceful. And the chattering voice isn't chattering so much. It's still chattering, but it isn't chattering so much. And I have this sense of peace. And when I meditate, and when I'm able to have that relaxation response, and that's what I'm talking about in terms of training yourself in relaxation, that same feeling of relaxation comes into my life. And I'm better able to slow down, and I'm better able to listen to people, and I'm actually more efficient and more effective, and more compassionate, actually, as well. So a simple technique can actually change the chemistry in your brain, and the studies show that it boosts the immune system, and there's a whole bunch of other scientific stuff about that. But I tell you that just to say that when I'm meditating, I begin to become aware of something that is greater than me breathing or me chatting. That I'm not necessarily just my body, I'm not necessarily just my mind, that there's a level of awareness that's there as well that connects us. There's some level of awareness that connects us everywhere else. So from a spiritual perspective, do whatever's right for you. There's a whole bunch of great data around prayer that's mind-boggling. And ultimately, you really can influence your physiology and your health and so on. Does it make a difference? I've given you kind of the body, mind, spirit talk, and there's lots of other ways to empower yourselves, but it doesn't make a difference. Well, yes. You know, I've showed you the scientific studies that improve longevity, you know, chance of recurrence, et cetera, et cetera. And there are also other studies that look at spontaneous remission. People who have undergone that transformation, I mentioned it earlier, had undergone transformation when the doctors thought it was never possible. And again, hundreds of cases have been studied. And again, there are certain personality traits that seem to do better. And one is autonomy. So the idea is that you're listening to yourself. You're not listening to others, you're not listening to society, you're listening to yourself and the inner wisdom that's there already. So they're autonomous and they're authentic. So they're authentic to themselves, and they actually put their thoughts and beliefs into action. So it's not just enough to think about it, it's actually have to step forward and do a little bit of exercise or whatever it is that's best for you. There's this degree of acceptance. And then these people also are able to express their love and compassion in life. They find their place, they find their niche, they find ways to love other people. And it's when they change that attitude and when they take care of themselves, that's the ground for things to get better. Now, I also am quite aware of this idea of the cancer hero, and if the cancer hero says, well, I did all those things, but my cancer still came back. Or I had a perfectly healthy lifestyle, but I got cancer anyways. Well, I've seen the perfect vegetarian who's stress-free and totally fantastic person get cancer. So there's no kind of guarantees in life. And I don't want you to walk away thinking, I've got to do more, I've got to do more, I've got to do more. It's really about living your life. It's about being happy. It's about expressing the compassion and that light of love within your heart and how you extend out to other people in your life. So I don't worry so much about cure rates. I think it's about living life, and the cure rates will take care of themselves. And so when your question changes from how can I live to how can I love, then I know you're on the right path. Thank you all so much for your attention.